Hi, everybody. Mary Ferguson Perret here, and I'm here in Deb Bournes' office, and Dr. Debra Bournes is our Director of Nursing for New Knowledge and Innovation and a treasured colleague among our team. She came to us to help us to build a research culture here at UHN, and that means, of course, a spirit of inquiry in everything we do, and also creating opportunity for nurses to get on the platform with all the other health professionals and be full participants in the research hospital. So I want you to hear all about what she does because, Deb, your leadership here has been pivotal in us building a high retention environment. And high retention environment, we started with research culture first, and it's really paid off for us. So can you just sort of say a bit about how did you get that going, helping us to build a research culture?
Wow, I can't believe it's been over 7 years since we started that. And when I came, we kind of talked about building it from both the high level of researchers who have PhDs and who hold chairs, and we've managed to get some funding for a variety of chairs in nursing research, in cardiovascular, in oncology, and patient-centered care, but also building the research capacity from among staff nurse level as well as advanced practice nurses and manager type level. And I have to say that I think we've been really successful on all counts. We've had amazing results in terms of being able to secure funding from external sources, over $28 million in the last several years, almost 300 external presentations in the last year alone. And we've had almost 1,500 nurses participate in research workshops. So it's been really fabulous. We've also had a lot of publications. So we've got some of the outcomes, but I think what it's created is also an evidence-based practice environment, because it's really hard to get nurses to read articles and engage in evidence-based practice models, and I don't believe that the ones that are out there work. What works is when they're involved in doing research, and I think there's many people out there who believe that staff nurses can't do research, but I'm here to tell you that at UHN we've proven that it is possible. And as you know, I talk about all the time, the best part about my job is our Nursing Research Challenge, which we just did for the 5th year in a row. And every year I think, oh, no one's going to come next year. But every year, and this year included, we have over 75 or 80 participants, and we limit it to 10 or 11 research groups. And they come with ideas, and we help them develop proposals, and then they compete. And some of the studies that come out, they're all relevant to their practice areas. I just met with one group who won a year and a half ago, who was doing a study on the meaning of fear for persons who have automatic defibrillators implanted in them. And I have to tell you, we've just started the data analysis, and the data that has come out of that has been absolutely, I've never seen such in-depth data about what it's like to have one of these things go off in your chest. And the nurses are just, I think, shocked, no pun intended, about what the patients and families have told them. Things like a bomb's going off in your chest, and they talk about the worry all the time, and then every time they get a shock, it starts it over again. So it's just incredible. And then just one more example, because I love this topic. I've also just been working with the group who did a study on changing expectations for persons who have had their surgery canceled at the last minute, which is a huge issue for some of the nurses in their practice here. And that study has some amazing data, but it's also just having the study going on in the surgical areas, and the findings have really helped to transform how surgical cancellations are handled at UHN. So they are making a difference, and it's just incredible.
I'll say it's incredible, and I think you also have your own program of research, and some things that we've actually done together, the 80-20 being one, and so can you talk a little bit about your own program of research in particular as well? Be sure to touch on how you've invented the Nurses for Tomorrow system and how you're using that to support the whole research culture agenda too.
Well, the 80-20 studies have actually taken on a life of their own. That is where, nurses have 20% of their time to participate in learning about patient-centered care guided by human becoming nursing theory, but also to do ongoing learning and development on projects of their own choice. And we've had, I think, 4 entire units had that opportunity here at UHM. And we just completed a mentoring study where we paired critical care nurses with new graduate nurses interested in critical care. And that was phenomenal in terms of the mentorship that some of the experienced critical care nurses were able to offer some of the new grads, but also the learning that happened in the other direction. And so that's been wonderful. And I just talked to someone in Niagara Health Region this morning who's going to help them to mount a study, I hope, that's similar out there. And the Canadian Federation of Nurses Unions also has some projects going Canada-wide. So it's very exciting. And we're hoping to be able to find some funding to do some ongoing fellowships and sort of an offshoot of the whole model here at UHN. And one of the things that came out of that was, as you know, as you mentioned, our Nurses for Tomorrow, which is our staffing analysis tool, which anybody who's here at UHN will be familiar with. But essentially, it's a predictive model where we look at what areas are in need of staffing predicted out for the next fiscal quarter. And we also look at some of the other factors and outcomes that are important to the complete staffing picture on the unit, like sick time and overtime and agency use. And then we're able to present for units and hospitals and entire regions or provinces a picture of where the staffing shortages are. And that has been, that's taken on a life of its own. We've got a wonderful contract with Saskatoon Health Region and hopefully across the province of Saskatchewan soon. There's several LHINs in Ontario who are now interested, and many other institutions, just sort of one-offs in Ontario. And also the Ontario Nursing Workforce Alliance, that through the Ministry of Health, part of my portfolio is working with Mary and Annabelle, who helped Vanessa Burkowski with some of her projects. And the Ontario Nursing Workforce Alliance, what we do is, with Nurses for Tomorrow, is we assess the different hospitals to see where the staffing needs are, and we're able to direct resources towards it. So it's very exciting.
And you know, the innovations coming out of your portfolio are substantial. And one of the innovations is right behind the camera over here. Nicholas Burkowski and Brudnicki. Gee, I've got you lined up with our Chief Nursing Officer for Ontario, Nicholas. But Nicholas and Kathy and the web-based innovations have just been amazing, and also Annabelle on leading the innovation projects for the Secretariat. These things are absolutely fantastic, but I guess I want to say...
So one very exciting thing, I know I'm not allowed to grab the mic,
go for
is speaking of Nicholas and Kathy Johnson and that Web-Enabled Innovations team, not only do they do a fantastic job with MFP TV and the nursing intranet, but we're just putting together the digital signage project where all of the units will have digital signage units within the next, or TV monitors within the next few weeks, and we'll be able to beam out different messages and different communications for all staff. So that's very exciting as well, because as you know, with nurses, it's very hard to reach everybody when we want to get messages out there. So this is a new and innovative way of doing that. New to the hospitals anyways, when you go out, you know, in the city, the digital signage is everywhere. But I think it's one of the first times it's been used in a healthcare setting, in Ontario anyway.
Absolutely. And so I just have to say that the innovation coming out of your team, Deb, and also the revenue generation coming in due to your team, to all of that helps with supporting the revenue, supports the research agenda, and has been pivotal in getting awards so that teams can do research. And I just have to say congratulations on all of that, Deb.
Thank you. And thank you for supporting it.
So that's our Debra Bournes. We're very proud to be associated with her. And thanks, Deb, for helping us to build a high-retention environment based on a research culture. That's it for today. Talk to you later. Bye-bye.